get on to the next panel discussion. Well, creating health equity through the holy grail, the data. Well, in a country like India, specifically, if you talk about, which, yes, does have a huge societal gap in identifying, understanding, and responding to the health inequities in different communities, this will allow every person to live well and long from generation to generation if we all sort of decode it well. Well, the Ayushman Bharat, the National Health Protection Scheme, in partnership with NITI Aayog, is an interoperable IT platform that entails, as most of you know, paperless and cashless transaction, and has been able to resolve it also to a certain point. But having said that, we know a lot's to be done still. Well, how can really, if you talk about data, really do the magic? That's something exactly that we are going to probe with our panel. So with me, I'm assuming that all of you, my dearest delegates, you're all set to welcome our panelists. So allow me to please welcome Hema Jagota, the Director, Clinical Solutions from Elsevier. Well, a health tech visionary that she is, with a passion for developing an integrated digital healthcare ecosystem that enhances patient or a member experience while improving affordability, availability, and the efficiency of care. Now, that's something so worthwhile to note. She's the one who has successfully accelerated growth operations of multiple Fortune 10 organizations to start with. Well, we're very happy to have you on board with us, Hema. And with that, allow us to please welcome Rajat Agarwal, the Deputy Director, National Health Authority, Government of India. Well, leading the technology division of the Ayushman Bharat, development of the CoWIN payment portal to facilitate the vaccine payment from hospitals to manufacturers, something that, may I say, is the backbone of the entire vaccination program at the same time, right? So integration with other major state and central government health schemes is something that Rajat cares about. Welcome to you as well. And with that, allow me to please greet Rama Vedashri, the CEO, Data Security Council of India. Well, Rama has also led the domestic IT and IT services verticals at NASSCOM, and also has also been the Director Sales Excellence at Microsoft Global Services. Welcome to you as well. We'll also be joined by Balihar Bark, the head of IT SPS Hospitals, who has a rich rich knowledge of corporate multi-specialty hospitals, retail and agri-based industry, rich hands-on experience both in infrastructure and also in the application. Well, I am, as I read about all of you and as I introduce all of you to our esteemed audience and the August gathering, I think this is exemplary, the kind of stature that you exhibit. We are more than honored to be welcoming you to the summit. So with that, allow me to also introduce to you the moderator for this panel, well, the seasoned Jaspreet Singh, partner and national leader, client and markets, technology and transformation, Grant Thornton Bharat LLP would be joining us. So with that, Jaspreet, if you're all set, here's handing it over to you.
Thank you. Very strange times that we're living in, especially the last 18 months. I'm a very avid reader of the World Economic Forum report, which they publish annually on the top 10 risks for that particular year. And you'd be astonished to know that in 2019 report, a chance that a pandemic will affect more than 50 countries was only given 9% probability. 2021, almost middle of the year, more than 180 countries have been affected by this pandemic. The data usage only in our country has gone up by about 900%, with every child today working or studying from home. That is the kind of data that we are generating. Forget all work from home, all corporates working from home. Given these times, the health data becomes even more important. Given that we have a huge societal gap, in which turn leads to health inequalities. And it is extremely important to identify, understand, and respond to this inequality. And therefore, there are schemes like the Ayushman Bharat, the COVID app, which are what they are doing is they are bringing interoperable IT platforms that entails a paperless, cashless transaction. The registrations become so easy, and it is helping us reach the masses. But have we fully tapped to this potential that the data offers to integrate the entire information technology system in the country? Your guess is as good as mine. High quality data is going to be much more important to ensure that the health program reach the last mile, especially in a country like ours. Once again, welcome to this esteemed conference. What I would do is I'll go turn by turn, and maybe we can start with you, Hema. When you were invited to this conference, what were your first thoughts, given that the importance of data in healthcare is something that your organization is pioneering on?
Sure. Thanks, Jaspreet. So, in the light of the pandemic, the adoption of virtual healthcare, adoption of telehealth has increased not only within the provider community, but also amongst the patient base. So it is important for us to now accelerate this telehealth or digital health revolution by creating an adequate health infrastructure to sustain this growth, and also have a robust infrastructure with institutionalized planning capability, effective execution, and center-state dialogue, considering that healthcare is a state subject in India, and having adequate PPP models to ensure we are able to realize the full potential of digital health solutions. And more importantly, we are prepared to respond to future pandemics. COVID-19 would not be the last pandemic to strike humanity, right? So we should learn from this and prepare ourselves by creating an adequate health infrastructure that will help us be better prepared to respond to such future pandemics. So when I heard about this panel, it was exciting because I think it's important, as all of us were discussing before the session as well, that we are able to create a robust infrastructure and integrate the key stakeholders within the healthcare ecosystem, which includes the providers, the patients, the regulatory authorities, the center and the state. And only then will we have an effective ecosystem for India to be able to better respond to future pandemics.
I'm very worried when you said this is not the last pandemic that's going to hit us.
Not to create any sense of emergency, but we have to learn from situations, and that's how growth happens.
Yes, absolutely. And an excellent point made on taking a top-down approach right from the national to the center to the state governments, everybody working together. I'll come back to you on that, Hema. Thanks a lot. Rajat, your opening thoughts, please.
So in continuation to what actually Hema said, very rightly pointed out that data is going to be very pivotal in the times to come, especially when we are executing schemes like Ayushman Bharat, COVID, etc. Where the last mile delivery and the last mile connectivity to a patient becomes extremely critical, and we are talking to someone who is or we are working on someone who is not actually. What I would say is that we are actually working on people we are not even connected to, and in such cases it becomes extremely critical for us that we are data driven, and we work on interoperable platforms, and we have data driven planning and data driven execution. So these are some of the very crucial aspects which we have to look in to when we go forward. And I fundamentally agree with what Hema said, that in the times to come, data is going to play a very crucial role in the health sector, for a more inclusive development on this front.
Wow. Great thoughts on more inclusive development, which is very, very important, because I think inclusiveness is what I think would be the keyword that we were looking for, right? It's very easy for somebody sitting in metros or even AB towns to open a COVID app and register. What about some of the villages, or the last mile that Hema and you rightly talked about? Balihar, your thoughts, or coming from a hospital perspective, where day in and day out you deal with data, and you're literally responsible for having the lights on from a patient health information system perspective. Your thoughts, please.
Yeah. So this pandemic has been very different in the sense that this pandemic has forced the healthcare providers to be more digitized, in the sense that patients want to avail the healthcare services, but they don't want to come to the healthcare facility. Especially in the first wave, they were kind of scared of coming to the hospital. So hospitals were forced to provide for video consulting platforms. They were forced to make them available their reports on the apps, on the web, so that they need not come physically to the and even this home collections, sample collection, and all, they were kind of forced upon the hospitals from the patient perspective, because it's in the first wave there was a panic and the patients were thinking, oh, if you go to the hospital you could be acquiring the infections. So it's not the hospitals which moved themselves towards the digitization, but it was the patients who forced the hospitals to move towards the data digitalization. It doesn't mean that we were not digitized earlier also, but the level of digitization was not up to that level. But in this pandemic, in this 6 months or 1 year, we have a kind of digitized up to that level. Plus, the acceptance of the patients was not that high of teleconsults or video consults. They were not that comfortable unless until they don't have the physical connect with the doctor. But this pandemic has shown them that they can avail the healthcare facility, they can avail the consultation even without being physically in the hospital, and then their care could continue. So this has been a great learning experience for providers, and hopefully even after this pandemic is over, we'll continue this digital journey, and this patient's outlook towards also.
Super. I think that's a great thought on number one, pandemic. When the pandemic is over, I think everybody on this call will and everybody listening would want to arrive at such a scenario. And yes, you're right. I think COVID hurried a lot of digital or digitization plans for organizations where they could make faster decisions. In April last year, I had to visit a doctor. I couldn't go because of the lockdown. I did a teleconsultation and it was very, very uncomfortable. Let me be very, very honest, right? Because I thought the hospital, I'm an IT guy, security guy. I understand how technology works. A lot of hospital people then did not understand. 18 months in the pandemic, I think the hospitals are doing a great job. Hospitals and the entire ecosystem. Let's not only talk about hospital, but the entire ecosystem that is providing telehealth is doing amazing job. And thanks to people like all of you on the call. Rama ma'am, your initial thoughts, please.
Thank you, Jasprit. Thank you for having me. The first and most important thing we need to look at is what has digitization enabled in healthcare over last few years, and particularly post-pandemic. If you just look at focus on the India experience, the most important thing is I think they're able to use technologies to be able to offer to the patient a certain experience and expanded patient care. That's what it is enabling. And almost, I mean, you talked about teleconsultation, but I would say that there is almost tele everything, where, it's not just consultations, there is a lot of continuum of care of the patient thanks to the technology that is being deployed. There's a lot of remote monitoring. There is a lot of teleradiology where the scans are happening in some part of the country. The interpretation and, the expert opinion is coming from maybe a tertiary hospital. The hub and spoke models between healthcare service providers, where there's a tertiary hospital at a district level or a state level, and the spoke could sometimes be a community health center, or it could be another smaller OPD clinic of the same chain, right? And we are also seeing a lot of partnerships that are happening between public and private healthcare facilities post-pandemic. It was also always there before also when you look at CGHS. It is also able to give a lot of universal view of the patient across all the disciplines within a hospital, and sometimes across the chain of hospitals, because sometimes a patient is referred from cardiology to oncology, or from the one department to another department, from your own hospital to maybe sometimes some e-prescriptions that are happening for the pharmacies, to the diagnostic or a pathology labs. All that is the first fundamental things that has happened in this digital. Now, when you look at all of this, there's a lot of harnessing of patient data, very sensitive information, mainly for the clinical protocols that a hospital has to follow, so that all doctors are able to have a single view of the patient. And another important thing is, how can this patient medical information and the entire records that are now digitized can help in better preventive care and better giving a continuum of care, right from the first visit of the hospital to post surgery, post treatment, something at home, calling them back for, the follow up visits. So I think the continuum of care is what is enabled, and typically the continuum of care may not be within the same hospital. There are many instances where from an hospital, the patient may be going to a semi-medical facility for the post-surgery care, sometimes maybe at home. In all of this, it's extremely important, while the data has to be harnessed for better patient, clinical care and their outcomes, and giving that kind of experience to the patient and their family, collaborating better with all disciplines within a hospital. How do you protect the data? Because all medical information is a lot of sensitive data. And how do you make sure that when it is shared between various agencies or between various organization units, how do you make sure that the entire patient information is protected well? That's a challenge that we need to address.
Perfect, ma'am. Sorry to put you on the spot right back again. You spoke about digitizing everything for the benefit of the patient, etc. But when I wear my other hat of a security and privacy professional, I am little bit concerned also, right? What if this data falls in the wrong hands from an insurance service provider perspective? The entire ecosystem, right? On who all can benefit from my SPII, or the special PII data, sensitive PII data. And given that currently we don't have an active data privacy law, yes, there is an IT Act, there are rules under that. What would be your comments on handling the privacy and the security of this data?
Yes, I think that calls for a lot of attention. I would not be so skeptical of data protection and privacy. I think while there is a pending data protection bill, at least we are engaged with a lot of CIOs in the health sector and CISOs in the health sector. There is increasing attention to data protection, privacy, security, because now there is almost everything in a hospital is technology led. It is not just, billing and patient admissions. The entire, life cycle of the patient care is technology led. So I think it is not just the CIO and CISOs. We are beginning to see attention from the founders and promoters of the hospital or the CEOs of the hospital. But yes, a lot more needs to be done, because there are hospitals of various sizes. Public hospitals, public sector, government hospitals are so large to be able to get the right kind of budgets and the people capability to be able to enforce. We are currently, as we speak, we have partnered with Chime to be able to do cybersecurity privacy strategy training program for the CIOs. Almost 90 plus CIOs are attending those programs over 5 weeks. We are surprised by the kind of attention and attention to detail in privacy that is happening. But definitely a regulation helps. It's not that pending the privacy bill, there are no regulations. The IT Act and the sensitive personal data does put enough attention. Healthcare is critical infrastructure, all said and done. And I think post-pandemic, given that healthcare and pharma sectors have been targets for a lot of cyber criminals, even national nodal agencies like CERT and all are putting attention. We need to, invest more in the people capability and the technology solutions. But I would say it's a long journey because of the volumes of data that healthcare institutions deal with, even at a district level, because the number of patients they service and the number of patients of different states that come to a tertiary hospital like an AIIMS or a tertiary hospital in a state capital. I think we need a lot more attention to this. A lot more needs to be done, but I would say that currently, at least in many of the larger healthcare institutions, the IT and security teams are beginning to, give adequate attention, because now everything they do is digital.
Very, very interesting thoughts, ma'am. On everything that we do is digital. We are taking small baby steps, but a larger legislation could probably give it a turbocharge, if I could put it in that way. Hema, coming from Elsevier, one of the largest global leader in information and analytics company, how does so much data, can it help me make informed decisions and policies? Your thoughts, please.
Absolutely. You're right, Jaspreet. By analyzing the data that's available, and as Rama ma'am was also saying, we now have larger amounts of data being generated in healthcare because of greater adoption of telehealth and greater consultations happening. We can certainly adopt a strong data-driven approach to population health management. A review of the data, analysis of the data, following all the data security and privacy laws by ensuring that it's anonymized and we don't have PII available, we are able to identify the key diseases that are prevalent in the country. And we can use those insights to manage the care for those patients. High-risk patients can be identified early on. Right now, as we know, the non-communicable disease burden in India is amongst the highest in the world. And over the last 1.5 years, because of the pandemic, the focus has not been as strong as it was before on care management, chronic disease management of these NCD patients. So there is an underlying disease burden in the country. And it is our responsibility now to analyze the data available to identify the high-risk patients early on so that their care can be managed across primary, secondary, and tertiary health segments of the country. In addition to chronic disease management, we can also use the data to do utilization reviews, identify where the highest cost specialties are, and again, leverage those insights to reduce the cost of care, which is another burden that our country is facing. India has amongst the highest out-of-pocket expenses that are borne by the patients. So the point is that we have greater amounts of data being made available, and there is an opportunity for us to analyze this data to achieve the triple aim of quality, affordability, and efficiency.
Wow, I'm just enamored by what we can do from if we are able to detect some of these chronic diseases earlier, then obviously we could prevent some of the catastrophes from happening. Perfect. Rajat, coming to you, given that you lead probably one of the largest healthcare programs the country is running. How does IT play a pivotal role in getting all this data that Hema, that Rama ma'am spoke about? To how does IT play a role from enabling all this?
See, I would like to highlight some of the points which have actually already come up in this discussion, before I actually answer this question. So, Hema, in the very initial remarks, said that health is a state subject, and uh, looking at the previous question which you just asked, one of the key challenges we feel is that the data available in the health sector is very fragmented, is not at all uniform, and there are no interoperable platforms where this data can be leveraged across states, across hospitals, etc. So that is a very key challenge, and that is where our organization, does play a very key role in terms of providing a platform across the states for all the people. IT, of course, has been a very, very crucial part of the Ayushman Bharat scheme, which has already enrolled more close to 15 crore beneficiaries, and close to 2 crore people have already availed treatment using the platform, and therefore, to capture such a large number of people, it is extremely important that the program is data driven. The program does use IT at every step. In fact, the three crucial steps, which I would say involves beneficiary identification and enrollment, involves the hospital empanelment, and the third is to actually delivering the medical services to the patient. So all the three crucial steps are intensively captured using the IT platform in Ayushman Bharat, and at the same time, there are other steps, including the claim processing, etc. So all of this becomes extremely seamless when we use an IT platform from identification of the right beneficiary. So that is extremely crucial, that we provide the services to the right person, and that once the person reach the hospital, it gets the intended care.
Perfect. So yeah, perfect. I think that's a super important point, and please hold your thought here. I would want to go to Balihar and again come back to you.
Please.
Mr. Balihar, Rajat spoke about getting all this information together to the hospital so that immediate attention could be given to the patient, right? But from an end user perspective, on somebody who's maintaining this at the hospital, what are the challenges you face from getting all this data in one place? And is at least coming maybe from a B or C town, working in a hospital there, what are your experiences around the user awareness from a data perspective?
Yeah. So to elaborate Mr. Rajat's point, yes, this data interoperability is a big challenge in India, because there are no healthcare standards defined, which are, all those are voluntarily. If they are, it's not enforceable on a hospital. Even if we talk about the codings, ICD codes for diseases and all, we are using the WHO standards. There are no as such codes which are specific to India. Even disease codes and everything, these are based, we don't have standardized codes. For me, it could be, USG abdomen, and for other hospital, it could be ultrasound something. So no, there's no standardization. There's a lot of work needs to be done on the standardization perspective. Of course, there are some HL7 engines available and all, but first, these hospitals should be enforced to follow those standards, so that data interoperability, or when the data comes to the centralized authorities, they could collate that data in real terms and present as a one subset of data. Yeah. Plus, yes, the collection of data is also tedious, definitely. Because if we were talking about that health equity or health inequity, in India, instead of ethnicity or region and all, it's more of rural and urban disconnect. The availability of healthcare services in urban area is obviously much more as compared to that of rural areas. So when the patients come to us, we capture all their information, their demographic details, their some of the options have to be voluntarily. Suppose if we say that, okay, you can tell your language, which is the mother tongue you speak, we cannot enforce the people. We cannot enforce the people to let us know their religion, their mother tongue,
Right.
and all that things. So
So it's a big challenge. It's a big challenge then in communicating, right? If I were to just put it that way. Thank you, Baliyar. Hema, I'll come to you on the challenges of interoperability and how does your company help deal with this. But Rajat, coming back to you, you were talking about the entire Ayushman Bharat scheme and how IT is playing a role. Please continue, sir.
Yeah, so very rightly said by Mr. Balihar. There has been extensive focus on saying that there has to be a data which we can use, which we can leverage. But there has been a very little focus on saying that, okay, this is the point where I'm actually collecting the data, and maybe we can use it in the future. So that is one of the very important perspective which we also need to consider as of now, that the scheme right now provides a very crucial data source which can be used later on to leverage better healthcare facility to the last mile person. And obviously, when you have a lot of data and that data is being collected in a very reliable manner and an authentic manner, being authenticated at multiple levels, and this data can actually be a source of a lot of information, a lot of processing that can be done in the future. So that is something which can bring about what is the discussion. The topic of the discussion is health equity, and I would say that that can fundamentally change the aspects of health equity, going in the future when we have a reasonable amount of good data which we are collecting as of now.
So if I understand correctly, reasonable amount of good data is the key term that we are talking about here, right? Hema, your thoughts on interoperability and how does your organization help?
Sure. So interoperability is essential, and it's absolutely important to follow the data security and privacy laws of the country in which we are operating. So as we heard the other panelists speak, India doesn't have the stringent data security and privacy as stringent as other geographies do. We do have the data protection law, which has been tabled recently. So it's important to leverage the available standards like HL7, like Smart on Fire, or ensuring that we are able to ensure the exchange of data through an anonymized patient feed, so that whether there are regulations or not, we are able to have an anonymized patient data, which can be combined with the evidence-based data to prevent a holistic view of the patient. And in fact, that is what the decision support platforms of Elsevier do. It is important to combine the evidence-based data, which is essentially reference information, with anonymized patient data, so that the clinicians are able to diagnose more accurately. And through a combination of evidence-based reference data with anonymized patient data, they are able to come up with effective treatment plans which have been backed by other peers and specialists in the industry. So essentially, it's important to follow the interoperability laws across the country as and when they exist. And while the laws are being developed, it's important to use the global best practices. All of us are familiar with HL7, ICD, Smart on Fire. So it's important to leverage those, because at the end of the day, nobody wants any fallouts, nobody wants any data leaks. And that is why it's important to leverage the global best practices while the local laws are being developed.
Wow, looking at the global best practices while drafting the local laws, I think that's what is happening. If you look at the, at least from my perspective, whatever I understand, the proposed data protection bill actually follows a lot of global laws like GDPR, the California Customer Privacy Act, and so on and so forth. Rama ma'am, in a country like ours, how easy or difficult would it be uh, to uh, to implement some of these data privacy laws, right? Because at least as far as I can tell you, from a privacy perspective, if you sit on if you sit with a stranger in a flight for 2 hours, after 2 hours you know their entire background. That's how concerned uh, we are about our privacy. But would love to take your thoughts before we open up for audience questions.
Yes. Uh, when you look at the PDP bill currently, which is tabled in Parliament, I don't know what the final version will be, but at least the 2019 version, it clearly calls out healthcare data as sensitive personal information. So the need for a higher elevated form of consent for healthcare data. Also making sure, even my other speakers talked about the right anonymization so that there cannot be de-identification of this patient data. Because the moment you talk about sensitive data, there are higher bars about the way you maintain the privacy and data protection. Also, I guess, given the current version of the bill, several healthcare institutions, particularly public and also many private large ones, which have chains of hospitals across multiple states, probably are going to be significant data fiduciaries. And the current PDP bill actually puts several more obligations on a significant data fiduciary because of the volumes of data or criticality data, adoption of emerging technologies. It is definitely a challenge. Why I would say a challenge is both the speakers talked about interoperability and portability. Forget about interoperability and conformance to standards across pan India. Even if you look at a hospital, it does not work in a silo. It is actually an ecosystem of service providers. There is an hospital, there are ambulance services, there are pathology labs or specimen collection centers, a pharmacy within a hospital but belongs to a completely different business unit. So sometimes there are long-term home care centers which are linked to a hospital. So even to make sure that the patient data flows seamlessly between these multiple agencies, interoperability is extremely important. Here, I don't think a data protection bill or legislation is going to address that problem. That problem should be addressed at a sectoral level so that there are self-regulatory practices, codes of standards, and how do you adopt that. And I think there are professional bodies in healthcare which are giving attention to that. While Jaspreet, you talked about GDPR and the California bill, I would like to draw the attention to health sector data protection privacy bills. For example, the Ontario Health Privacy Legislation, called PHIPA, is extremely advanced in its thinking on what health sector should do. So it's not just a national legislation, they have the concept of a health custodian and what are all the obligations of a health custodian. The custodian could even be an ambulance service provider who's not really a true, hospital, right? So that is there. And there's another one in Germany where they're saying that the patient should have access and control of his or her own data, where they can choose to do data donations. That means I, as a patient, maybe some cardiac or oncology information, I should be able to donate only this specific part of my patient data to a researcher or to a hospital, which means the obligation, if these kind of legislative thought process comes in the health sector in India, the kind of maturity that needs to be there in the way you design your applications, the way you make access to select data to a patient, a lot needs to be done in this regard.
But it would be revolutionary, right? If I could, as a patient, if somebody's already gone through the same kind of treatment, and those records are made available to the doctor, obviously for reference purposes, while taking care of the entire anonymization and everything, it could really be path breaking. Thanks a ton, all the four panelists. It was a pleasure moderating this. We've got some audience questions, and I'll read out these questions. Please feel free to pick up these questions. Whoever wants to answer, or I'll probably take out names. So Pawan Kamra asked that the pandemic has taught us that each region in itself needs data-driven, customized approach. What needs to be done to ensure better data handling, empowered decision making based on at a local level? So Balihar, maybe probably since you are very close to the end user, maybe you would want to answer this.
Yeah, so definitely. Say now this pandemic. If we don't talk about pandemic now, this say dengue in this part of the country in these months, this dengue starts comes up in a big way. So at least this kind of data could be stored with even shared with the government authorities, that these are the months in which there are spikes of dengue in these particular regions, so that governments definitely government local authorities could definitely take a corrective measures on that. There's a lot of scope for sharing that, taking that data and handing over that data to the local authorities and take a corrective measure on that.
Super, great take. Hema, I think your favorite question. Dr. Kushal asked that what are some of the newer areas of focus now in terms of data gathering, right? What are the multiple sources of data gathering that probably we can see in the entire ecosystem?
Sure. So, I think one of the panelists alluded to in the discussion that it's important to create health equity in the rural areas as well. So right now, there is a very strong focus being put on instilling health solutions in the primary healthcare sector as well. Through Ayushman Bharat, the government is setting up 150,000 health and wellness centers, which also include as one of the 12 components that a health and wellness center should have. So the data that will be generated from these primary health centers is going to be very important in disease surveillance and ultimately population health management of those particular districts. So that's an important area. Secondly, there's a lot of emphasis being put on preventive and promotive care. There is a deliberate reason why we are talking about wellness. Earlier, it used to be just healthcare. Now it is health and wellness. So greater emphasis on analyzing the data for preventive care, for promotive care is very important. And thirdly, leveraging some of the indigenous Ayush practices, leveraging some of the Ayurveda-based best practices, all those elements, when applicable, for long-term care, for preventive health, for promotive care. So the data can also be analyzed to look into these areas as well. So these are some of the innovative ways on the clinical side that the data can be analyzed. And on the insurance side, as I mentioned earlier, it's important to analyze the data for utilization reviews, to identify the specialties where higher costs are being borne, and then look into those specialties to reduce the cost of care. So both on the clinical side as well as on the value-based care side, there is a lot of innovative analysis that can be done with the data.
Rama ma'am, Rajat, please feel free to pick up this. Dr. Nitin asked, what are your suggestions to strengthen the disease surveillance machinery in the country?
Yeah, so a very pertinent question. I would say that again, data can obviously be a very easy and fundamental approach, I would say, in order to strengthen the disease surveillance machinery in the country, because capturing something as simple as saying that a particular region in the country is showing an uptake in a particular number of segment of population, catering to a particular symptom or a particular disease, can give a very suitable alarm. And actually, I want to link this question to the previous question also with regard to empowered decision making based on the local level. So there has to be a very coherence or what I could say an integration down from the local level up to the national level, where we are able to provide suitable feedbacks or suitable what dashboards, what I would say, where these local level authorities can actually use these to get a broader picture in terms of at the district level, at the state level, or perhaps at the national level. And that is extremely crucial, which is going to serve strengthen our disease surveillance machinery as well. Because if these things are going to happen in a very isolated manner, obviously it is going to be very challenging for a local unit, to make a bigger picture out of what is available. So for that, I feel a very a centralized approach, closely integrating the decentralized unit. That is what is extremely critical in the future.
Jasprit, I have a point to add to what
Please,
Mr.
please,
Ranjit is
please,
saying.
ma'am.
I think in this entire disease surveillance across whatever diseases we are talking about, whether it's waterborne, infectious, all of that, I think it's extremely important to have national level platforms. It does not really help if one state, has an extremely vibrant, robust disease surveillance system, and a few other states don't have any technology platforms to be able to do this. So how do you make sure you put a national level platform and give that access at the last mile? Because in several states, healthcare centers at a community health center level, or the ASHA workforce, they don't really have access to that technology systems to be able to update the data. So having that national health platforms in which data can be not only updated, but there is visibility to all the agencies across state and center and district, and making sure that there is access and some level of training at the last mile, so that that community level health workers are able to actually update these systems. Unless we do this, there will be things in silo, but I don't think it will really help at a country level, because some states have done quite a bit in terms of integrated health management information systems, even 5, 6, 10 years back. But in many states, we are yet to see basic HMIs in a particular state. And all said and done in India, a lot happens at a state level, and lot happens in the public sector healthcare, right? And then, of course, there are corporate hospitals. So we need to have these national platforms where the community workers of public sector and every private sector hospital is mandated to update them. I don't think that is still happening. We have a long way to go.
No, but actually, I do see that we are going to see the light at the end of the day, because there are a lot of things which are going on in this
there are baby steps
particular
that are happening. Yes,
yeah, there
but
are.
there's
No,
still long
actually,
way to go.
not in fact baby steps. I would see that we are taking leaps on all these fronts, in terms of having a national HMIS, a full-fledged NDHM, in terms of having interoperable platforms across the country, where patient consent is foremost in terms of data sharing, and there is a focus on data privacy, but not at the cost of quality delivery of services to the patient. So these kind, obviously Ayushman Bharat is already taking care of a lot of primary and tertiary health care at the local level. So I feel that we are actually moving in the right direction on that front.
Perfect. I think it was a amazing panel. Thank you, all the esteemed panelists. I've learned quite a lot during the last 45 minutes. Thanks for being such greatly responsive to all the interactions, and look forward to seeing you again. Stay safe. Bye.
Thank you. Thank you, everyone.
Thank you, everyone.
Bye.
Thank you so much. Thank you so much.